Jane Schillie. I'm on the faculty at Kansas State University. I work in the library in the special collection department, which means we have all the stuff that no other libraries have. I had an open bite. It's something that I've had most of my life. I had great difficulty eating. I couldn't chew food very well. I always felt like I was kind of choking, and it made it so I kind of feared eating. I went to see several orthodontists and several oral surgeons, and they all said the same thing. The only way to fix this condition, the open bite, is to have surgery. And my doctor was Dr. Rieck, Kevin Rieck. And we were all very impressed with him and the attention that he paid me. He spent about 45 minutes with me during a consultation, and at that time I decided to go ahead and have the surgery.
Patients with these open bite deformities tend to be severe. In Jane's particular case, she had an upper jaw surgery and a lower jaw surgery as well. The upper jaw procedure was basically brought forward and raised up as well as expanded. The lower jaw was then advanced as well. And then patients are typically wired together in the operating room for these procedures, and that is holding the bite in the new position. But once we have the hardware in position, we can cut the wires and they're able to open and close immediately. I sort of look at these cases as a team approach. We do these cases nowadays with the use of CT imaging, and then with a very elite group of biomedical engineers. We basically position everything in 3 dimensions how we want it. We can kind of pre-plan the surgical cases that way. And then they allow us they fabricate some surgical splints for us that we can use at the time of the surgery that help us put the bite into the pre-planned location that we had determined ahead of time.
During the recovery from the surgery, it was really pretty easy. After the surgery, I spent one night at Bryan, and everyone was super, super nice to me. I felt like I was at a 5-star hotel, and it was just beautiful and very, very quiet, which I appreciated. I could start on a soft diet right away. The swelling was down in about 2 weeks, and I came back to see Dr. Rieck. He was pretty pleased with how things were progressing.
Jane was an excellent patient. We sat down ahead of time and went through all the different risks and benefits and alternatives and ways to manage these types of procedures. And so she was very compliant with things that we had talked about as far as preambles for the surgery, and then subsequently afterwards as well.
I would recommend this procedure. It truly has changed my life. I could chew things using all my teeth like a regular person, a normal person. I could bite through things like tacos. That was a really big deal. Pizza was a really big deal. I just felt better when I ate. It changes your whole outlook on life. You can eat like a normal person. Absolutely, I would encourage people to go through this.